Hello, this is Dr. Jagdish Shinde, and my today's video I am going to tell you information regarding treatment of rectal cancer. Before starting video, I just want to inform all the patients that if any patients want to do online consultation with me, then I have given a link in the description and as well as in the comment box. You can click on the link and connect me directly through WhatsApp and ask your any questions and consult with me. I can guide you regarding any type of cancer treatment. So let's start the video. So friends, in last video I have explained what are the causes of rectum cancer and how to prevent rectum cancer and what are symptoms of rectum cancer. And in this video I will tell you regarding the treatment part of rectum cancer. If anybody is getting diagnosed with rectum cancer, which are different tests which are useful in treatment of rectum cancers. So the number one test which is done in treatment of rectum cancer is biopsy. So the biopsy simply means taking a small piece or small bit of a rectal tissue or tumor tissue, and we test it under microscope in the laboratory, and this is called as a biopsy. The biopsy is used for confirmation of diagnosis. Also we understand what is the type of tumor and what is grade of tumor and what are different molecular can be done in biopsy. So biopsy is very important for initial diagnosis of the disease. The second test which is done in rectum cancer is PET-CT scan. PET-CT scan is basically done to evaluate the stage of the disease. So we understand whether the cancer is limited to the rectal area or whether it has spread to the lymph nodes or bones or liver or any other site in the body. So the PET scan is needed for initial evaluation and staging of the disease. The third test is CEA or carcinoembryonic antigen. This is a blood test which is done commonly in the rectal cancer. It is a tumor marker for rectal cancer. So this is done. Then we have to do some other evaluations like general evaluation of the patient, CBC, LFT, RFT, echo. These general tests are done to know the fitness of the patient and for fitness to the therapy. So once all tests are done, then treatment is started. Rectum cancer treatment is divided into three parts. One is surgery, second is radiation, and third is chemotherapy. So starting from surgery. In rectum cancer, there are two types of surgeries which are done. First surgery is called as sphincter preserving surgery, also called as anterior resection, and second is abdominoperineal resection, in which sphincter is not spared and we close the opening of the anal canal. So the treatment or surgery depends on what is the location of the rectal tumor. If the tumor is located away from anal sphincter, then we can save the anal sphincter, and the area of intestine which is cut which can be connected, and the patient can pass normal stool through a normal anal opening. If the tumor is located very close to the anal sphincter, then it is not possible to save the sphincter, and patient has to undergo colostomy. The colostomy is the opening made in the abdominal wall, and we make a rectal opening through the abdominal wall, and bag is attached to the abdominal wall which is called as colostomy bag, and through this bag patient can pass the stools. This is called as abdominoperineal resection. So these two basic types of surgeries are done in the rectum cancer treatment. The second treatment is radiation. In radiation, what we do, we treat the patient with some X-rays or gamma rays. We decrease the size of the tumor. Many times it has been found in the various studies that if we give radiation therapy before doing surgery, then patient might have a lot of benefits. The possibility of preserving sphincter is increases if we use radiation therapy before doing surgery. In radiation, we treat the tumor with X-rays, and thereby the size of tumor will decrease. And if size of tumor decreases, there are more chances that sphincter will be saved. Also, if the size of tumor is large, then by giving radiation we can make it operable, and after giving radiation, doing surgery will be very easy and we can remove the tumor very easily. So that are various benefits of using radiation therapy before doing surgery. So if you are diagnosed with the rectum cancer, then you must take a opinion of radiation therapy doctor, radiation oncologist doctor, so that radiation therapy can be planned before doing surgery. So how to plan radiation? So radiation is basically OPD basis treatment. It is given generally Monday to Friday. Saturday Sunday will be off, and it is given over 5 to 6 weeks. After doing radiation, the gap of 1 month is given to the patient, and after 1 month patient undergoes surgery, and after surgery again chemotherapy might be planned. So this is how generally rectum cancer treatment is done. The sequence of surgery should be done initially or radiation should be done initially. It depends on the stage of the disease, and it has to be discussed in detail with your doctor. The third treatment is chemotherapy. The chemotherapy part of the rectum cancer is highly complex, and it is very difficult to explain in the single video. But typically the chemotherapy is given every 2 weekly, or some regimens are every 3 weekly. There are newer drugs, targeted therapies, immunotherapies in the rectum cancer. But the use of these drugs depends on the what type of cancer is there, what type of mutations present in the tumor. So it is very complex. But most of the patients will need chemotherapy at some point of time in their treatment. So these are the different types of treatments are there. The sequence, whether to use chemotherapy before or whether to use chemotherapy later, or whether to do surgery first or radiation first, it depends on the stage of the disease, and it is a multidisciplinary approach is needed. If you want to know more about the treatment of rectum cancer, you can just click on the link given in the description, and you can directly connect with me for any kind of cancer advice. Also, I have given my clinic address. You can directly come to my clinic and consult with me for cancer treatment. Thank you very much.